Today's webinar is all about health checks. DSPT started and social care providers came in at 2019. So it was already established, but we came in at 2019. And then in 2021, the Digital Care Hub, or the Better Security, Better Care program with the local support organisations. And in 2025, we started to introduce health checks, and that's what this webinar is all about. What is an onset health check? So it's an in-depth assessment that we conducted by myself and Felicity. We come out and we have a look at, so one of the first things we ask for is for you to send us your DSPT, the last submission, and then we can have a look at that and just go over it and maybe make some suggestions. I've seen quite a few where people have literally just ticked all of the boxes. There are a few questions where you've got to put in a comment, but a lot of them you can just tick the box without any comment at all. And with those ones, it's like, well, I know you've ticked it, but why did you tick it? There's a good one about cybersecurity and data security. And a lot of people cover that within either their induction or their training program or both. So we'd always encourage people to put, where are they covering it? So yes, you're covering it. Where are you covering it? So we'd have a look at that. And then we look at other things like policies and procedures. A good one's always the privacy policy. Most people have those on their websites. If they have a website, hold people's data. How are we holding it? For what purposes? Great news is we can boost the confidence by saying, yeah, you've done an awesome DSPT, and then looking at everything else, pointing out where we feel that things could be done slightly differently or things could be implemented just to make things that little bit more secure. And yeah, it identifies areas that people are great in, but also where things could be improved. And that's with signposting and support. With the health check, it's about sort of having a look at what's in place and then giving recommendations. And during the visit, they do go on for about 2 hours, so they're quite an in-depth visit. It's the basics. So how staff made aware of data protection responsibilities and the training and things like the information asset register and also the record of processing activities as per the laws. They also look at any policies and procedures and maybe if there's any missing. And then what security arrangements are in place. So password protection, firewalls. One of my ones, the automatic updates are turned on or not. We've got an amazing little program that CyberSam from Digital Care Hub's written, which we run a sort of a background program on up to 3 computer systems. They've got to be Windows. It will do things like there's a couple of harmless websites that when it runs it, if the software's in place, it will just come up and say this website's been blocked. It's a really good little program. Business continuity arrangements in place. And one of the ones that I've been to, they've got a very, very good business continuity planner. But your digital social care record, how often is that updated? And, you know, other things like, has it ever had a cyber attack? Has it ever had an extended outage? If it did, how long would it be before you got data? And how much data would they be able to give you? And he didn't know, and he hadn't thought to ask. I think a lot of people within social care are very aware of the sort of traffic lights, red, amber, green rating, and ours is no different. Here are the contact details. There's lots of support out there.